về thế giới thanh lương. Bạch hà không tước, giả ca diễn pháp thần thông như ý, đi khắp mười phương cúng dường. Lệ Tây Phương, sen vàng chín phẩm ngã thường, châu đất vàng trang nghiêm thanh tịnh vô biên. Gió thổi cây bóng vang lên thiên nhạc du dương, người nghe khởi ý phát tâm niệm Phật pháp đồng. A Di Đà Phật, A Di Đà Phật, đại phóng từ quang vô lượng, hóa độ chúng sanh.
Phật. Trân trọng kính chào tất cả liệt quý vị. Chúng ta xong chưa? Rồi, thì chúng ta vô tivi được phải không? Nhà sư Trí Quang có thể dịch giùm một chút. Nam mô Bốn Sư Thích Ca Mâu Ni Phật. Kính thưa liệt quý vị, giờ đây trong khóa đại lễ trùng tụng Tam Tạng Kinh Phật giáo quốc tế tại Đại học Sayagyoda, tuy bước đầu còn sơ khai, nhưng chúng ta đã thể hiện một cái tinh thần rất mạnh mẽ, tinh tấn của người con Phật. Và giờ đây là giờ chúng ta đi vào chương trình hội thảo.
Okay, even our university is just a step established, but we try to collect and present our economic work. So now we start our seminars.
Kính xin phép các vị, trong chương trình hội thảo có giáo sư diễn giả trong tại hôm nay đến từ Đại học Naropa.
Today's seminar we have professors from Naropa University.
Chúng ta cho một lần phép thầy. Kính thưa quý vị, Đại học Naropa là một đại học do Đại sư người Tây Tạng sáng lập, mà nó thể hiện một cái tinh thần Phật giáo Tây Tạng rất là sâu sắc. Là một trường đại học nổi tiếng, đã hiến tặng cho nước Mỹ này nhiều học giả, có nhiều cái công trình nghiên cứu và những tác phẩm nổi tiếng. Và Đại học Sayagyoda của chúng ta không phải như Đại học Naropa, nhưng nó cũng một phần thể hiện cái sắc thái đem đến nền hạnh phúc cho cộng đồng người Mỹ nói riêng và cho nhân loại nói chung.
Naropa University is established by Tibetan monks and attributes many academic works such for document human beings. And Naropa's university and Sakya's university is not completely the same, but we think that we can learn some parts of Naropa University.
Chúng tôi muốn xin phép tất cả quý vị ở đây cũng như giáo sư diễn giả, đó là trong chương trình thuyết minh đề tài của mình, chúng tôi cho truyền hình trực tiếp ở trên band tầng 57.15 và các band tầng truyền thông của Đại học Saryaputta.
There's special guests. Let our universities broadcast to TVs world the professor's presentation.
Hiện bây giờ chúng tôi thấy các cái thông số kỹ thuật mọi người đang theo dõi ở trong cái chương trình hội thảo này lên tới hơn 10.000 người.
Our TVs, there are over 10,000 watching.
Chúng tôi hy vọng đề tài của giáo sư trình bày hôm nay đem đến cho các vị rất nhiều những cái kiến thức mới lạ ở trong Phật học cũng như là ở trong Phật học hàn lâm học thuật.
We make sure that these topics today will be useful for all of you and also useful in the academic world.
Xin thay mặt cho Đại học Saryaputta, chúng tôi xin kính chúc tất cả các vị gặt hái được nhiều kết quả, nhiều tri kiến và đặc biệt là gửi lời cảm ơn đến giáo sư diễn giả hôm nay. Đề tài của giáo sư trình bày hôm nay đem đến cho các vị rất nhiều những kiến thức mới lạ ở trong Phật học cũng như là ở trong Phật học hàn lâm học. Giáo sư
all the best
diễn giả hôm
and
nay
also everybody too.
một lời chúc sức khỏe. Chúng tôi muốn nhường không gian này lại cho giáo sư hiệu trưởng. Mời giáo sư hiệu trưởng lên phía trên để điều hành chương trình.
Okay, now it's turn for our Chancellor Victor Cabrera.
Chúng tôi muốn không gian lại cho giáo sư hiệu trưởng lên phía trên.
Okay, now it's time for our Chancellor Victor Cabrera.
So I'm very thankful for the words of encouragement from our founder and president, Venerable Master Thi Chuen Chao. I want to welcome you to our Vesak 2650 International Tripitaka Visitation Ceremony, and today is our third lecture series or fourth lecture series. I graduated from Naropa in 2005. So I am very proud of this connection. Yeah, and also Naropa celebrated their 50th anniversary last year. So I want you to imagine Sakya Buddha University
proud of
like that.
This connection.
And now,
And
can you
also,
imagine 50
Naropa
years from now?
celebrated their 50th anniversary last year. So I want you to imagine Sakya Buddha
So
University.
with great
like that.
pleasure,
Now,
I would like
can
to
you imagine 50 years from
introduce
now?
our lecturer, because we have so much to learn from her. She actually teaches this
So
in a
with
semester worth of
pleasure,
class. So we are just
I
going
would
to ask her
like
to
to,
condense it
introduce
into
our
this hour with
lecturer.
us. So Dr.
We have so
Marina
much to learn
Dorian
from her. She
is an
actually
associate
teaches
professor
this
in the
a
mindfulness-based
semester worth of
transpersonal
class. So we are just going
counseling
to ask her to condense it
program at
into
Naropa
this hour
University.
with us.
As a
So
psychologist,
Dr. Marina
meditation
Dorian
instructor,
is an
and
associate
contemplative
professor in the
educator, she
mindfulness-based
integrates
transpersonal
mindfulness
counseling
practice, clinical
program at
experience,
Naropa
and relationship
University. As a
dynamics into a
psychologist,
teaching
meditation
and
instructor,
research.
and
Marina
contemplative
holds a
educator,
doctorate
she
degree in
integrates
clinical and
mindfulness
community
practice,
psychology from the University of
experience,
Illinois
and
at
relationship dynamics
Urbana-Champaign
teaching
and
and
previously
research.
taught at the
Marina
California
holds a
School of
doctorate
Professional
degree in clinical and
Psychology
community
at
psychology
Alliant
from the
International
University of
University.
Illinois at
With 3 decades of research experience, Marina's work explores mindful relating, stress and resilience, and the intersection of cultural and relational dynamics. She is also an active member of the Institute of Violence, Abuse and Trauma, where she addresses complex trauma and interpersonal violence.
She is also
In
an
addition
active
to her
member of the
academic work,
Institute of
Dr.
Violence,
Dorian
Abuse
has
and
maintained
Trauma.
a
She addresses
coaching practice
complex
dedicated
trauma
to
and
mindfulness and relationship
interpersonal
enhancement. and co-hosts the Love
to an academic work,
Liaisons
Dr. Dorian
podcast
has
about
maintained
modern love
a
and
coaching
relational
practice
issues.
dedicated to
A
mindfulness and
dedicated
relationship
meditation practitioner for over 20 years,
the
Marina
Love
follows the tradition of Thich Nhat
Liaisons
Hanh and
podcast
is a
about modern
facilitator in
love
her
and
local Sangha.
relational
She is
issues.
passionate about
A
contemplative
dedicated
practices,
meditation
including
practitioner for over
yoga,
20 years,
meditation,
Marina follows the
art,
tradition
dance,
of
and
Thich Nhat
connecting
Hanh
with
and is a
nature, which
facilitator in her
deeply
local
informs
Sangha.
her
She is
pedagogy and
passionate
personal
about
life.
contemplative
So with great
practices,
honor,
including
we want to learn from
yoga,
you, Marina.
meditation,
So welcome.
art, dance, and connecting with nature, which deeply informs her pedagogy and personal life. So with great honor, we want to learn from you, Marina. So welcome.
Hello, and thank you, everybody. So wonderful to be here. And so I'm currently at Naropa University, which is located in Boulder, Colorado, where I lived part of the time. But currently I'm residing in San Diego, California, and I teach remotely. So that's it was wonderful for me to just drive up and be able to be here today. So I wanted to talk to you today about mindfulness in psychotherapy. And first, I wanted to offer a definition of mindfulness that's often used by psychologists. Of course, there's mindfulness in the Buddhist tradition, but I want to offer this definition by Jon Kabat-Zinn, who's an American scientist, writer, and meditation teacher. And he talks about mindfulness meaning paying attention in a particular way on purpose in the present moment and non-judgmentally. So this is one of the things that we'll be talking about. This is a definition that's often used in the field of psychology and counseling to really refer to how to use mindfulness in psychology and counseling. And I'll try to make this a little bit brief because, I could really, this is really a class. This is really like something that we teach in a semester or maybe even in a whole year. Because when you talk about mindfulness in psychotherapy, for me, there's really three parts to it. So the first part, I think, almost the most important part, and this is the therapist's own personal practice. This is the therapist learning to practice themselves, whether it be formal meditation or mindful living in everyday life. And this is very important. The second part is the theoretical orientation. So you start with the person of the therapist, what they're doing. And then the second part is like the theoretical orientation, how they're thinking about the client, the people that they're working with. And then the third part is actually what they're doing. Like that's on what they're doing with the client. And that's the clinical intervention and how mindfulness is then integrated into therapy. So I'm going to try to talk about all three, and we'll see what we have time for. So coming back to Jon Kabat-Zinn's definition of mindfulness, this paying attention on purpose in the present moment, non-judgmentally. So the key elements of this have to do with intention. They have to do with present moment awareness, non-judgmental observation, acceptance, and also a compassionate attention. So this is a contemporary psychotherapy type of adaptation of mindfulness from the original Buddhist tradition into a secular clinical framework. And, of course, as we're here, and, we know that mindfulness originates from a Buddhist contemplative traditions. And one of the reasons, I offer John Kabat-Zinn's quotes and definition is because he's one of the more famous American scientists that popularized mindfulness into American, Western and American medical and psychological frameworks. So, shine a light on another famous psychologist, Shauna Shapiro, who came up with a model of mindfulness that has 3 parts. It's similar to what John Kabat-Zinn had discussed, but she has a 3-part model, and this has to do with intention, attention, and the attitude. And I think this last part, the attitude, is very important. So the intention is that, why are we paying attention? What is our motivation? And we're doing this on purpose. This isn't, by accident. And this really shapes the therapeutic direction and the stance that you have, so that this is what you're doing on purpose. And the attention is something that we often know about. This is paying attention, moment to moment, the experience, awareness of your thoughts, awareness of emotion, behavior, and having a flexibility in your awareness as well. And the third part, I think that this is very important for contemporary psychotherapy. And this is really the quality of awareness brought to the experience. And that's the attitude. Because you can pay attention to something on purpose, but if you have an attitude of judgment, like you're paying attention and you're saying, oh my gosh, is this good or is this bad? Is this right? Is it wrong? Is it pretty? Is it ugly? You could put your attention on something with an attitude of judgment, but here the quality that we want to impart in the therapeutic process is that there's this attitude of non-judgment. And that attitude is both from the therapist, and then we're hoping to teach it to the client as well, that it includes curiosity, kindness, compassion, and non-judgment. That, there is an experience, and allowing the experience just to be the experience without always having to say that, okay, this is good, this is bad, this is right, this is wrong. Allowing yourself to have this experience. So I want to touch upon the intersection of psychology and Buddhism. Of course, there's a Buddhist psychology as well, but there are core Buddhist concepts that are really relevant to psychotherapy that I think make the two fields come together. For example, suffering. Most people go to therapy because people don't usually go to a psychologist, just to talk to somebody, they go because they're suffering. And this is a key tenet, of course, of Buddhism, that there is suffering. And psychological distress, this is part of the human condition as well. Physical distress, psychological distress. And what makes people suffer a lot is when they try to avoid something. They avoid what they are worried about, or they avoid what they're afraid of. And this often intensifies their suffering even more. Of course, also other concepts like impermanence. This is a very important concept for psychotherapy because whatever you're feeling, have it be anxiety, depression. You cannot feel it forever. Like a wave cannot go up forever, it has to come down. And so, too, the difficult feelings that people may have as well are impermanent. And I think that this is some people think that impermanence is a challenging topic, but it is, even the difficult situations people have, those will too change. So this concept is very relevant to psychotherapy. Non-attachment, another concept very relevant to psychotherapy. And what a mindfulness practice really would help with is helping to reduce this over-identification with thoughts and emotions. Sometimes people have a thought and they're like very much holding on to it. So a non-attachment to the thought, perhaps seeing the thought as just a thought, and having an emotion that's just an emotion without being so attached to it. This also supports what we call emotion regulation, being able to, not drown in the emotion, being able to feel it, identify it, but not attached to it. So other concepts like compassion are very important in psychotherapy. There's the compassion to yourself and compassion to others. And this is important also from the therapist and for the client. I teach a class that's called Compassion in Counseling. And we teach students that are counselors, first how to be compassionate with themselves. And that self-compassion is important for compassion to others. Because oftentimes, we have folks that want to help other people. They're very good at helping other people, but they hold themselves on the hook. They're very hard on themselves. And, we have students, maybe students like this, maybe you've been like this sometimes, where you're very hard on yourself, but you're quick to help somebody else. So this concept of compassion is very important to therapy. And then finally, interdependence, that we are all human and that human suffering is part of the condition, part of being human. Healing can occur with relationships, and having people know that they share a common humanity. These concepts, that are core to Buddhism are also very relevant to psychotherapy. And so when we think about an integration of mindfulness and contemplative traditions in psychology or counseling, some of these main themes are that mindfulness transforms both the therapist and the client. Presence, like just being present when you are in a counseling, in a therapeutic environment. There's actually been a lot of research that has found that the relationship between the therapist and the client, between the counselor and the clients, just that relationship, the presence that they have, is more important than the technique they use. It's more important than, are they using dynamic psychotherapy? Are they using cognitive behavioral psychotherapy? Do they have some kind of a systemic approach? Those are, informative approaches, informative theories and therapies. But in general, there's actually been quite a lot of research that says that the relationship is more healing than the specific approach that you have. And mindfulness practice is what can really help the therapist establish that kind of presence. So the therapeutic change that can emerge from awareness. Mindfulness deepens your empathy and attunement, certainly. And yeah, the psychotherapy and contemplative traditions, they share goals. So the central idea is that even though a lot of times, in training therapists, especially in the West, counselors and psychologists in training, they talk to students about certain tools that they can have. They talk about like a therapist tool belt. So mindfulness is not a tool. This is just a way of being with clients. It's more than a tool. It's more than, okay, well, we know how to do assessment, we know how to do testing we know how to do some behavioral approaches. We know how to do some kind of family systems work. So it's more than a tool. It's really a way of being with a client. So as I mentioned before, I like to think of these three roles of mindfulness in psychotherapy. And I'm going to talk about them, one by one a little bit more. So first, I really want to talk about the therapist's personal mindfulness practice. So if you are wanting to become a therapist, a counselor, any kind of a helping professional, um, I think that this first one is really the most important. You cannot jump, jump back. You cannot jump to the clinical intervention like, I want to learn how to integrate mindfulness into therapy. How do I teach my clients to be more mindful? Okay. Well, we need to start with you. So I really feel the therapists cannot authentically teach presence without cultivating it themselves and cultivating it through this mindfulness practice. And of course, there's a list of all of the benefits of the therapist's mindfulness. You know, uh, Being a therapist can be challenging. So, therapists, not only do our clients have problems with emotion, they have anxiety, they have depression, they have trauma, but the therapist needs to have emotion regulation. Believe me, if you have a client that says the scariest thing, that they are thinking about ending their life, they are so upset, they are so devastated, they're so depressed, they have so little energy that they've been thinking about ending their life. You have to remain calm in this time. You have to remain calm for yourself and for them to help them to do the things that can really help save their life. In many cases, that's the most extreme scenario. So, and because therapists oftentimes deal with really critical situations, they can get burnt out. And there's something called compassion fatigue. It's a strange term because I think that real compassion, you cannot be fatigued. It's a strange term, but it's commonly used in the psychology field. Um, I'm not sure that in a Buddhist framework it really makes sense because I don't know how you can have a fatigue of compassion, but it's more of maybe like an empathy fatigue where you're working with people, you want to help them so much. And I've actually seen this. I've seen this when I was a student in training. I had supervisors that had worked for many years. They were close to retirement, maybe 1 year, 2 years away from retirement. And I could see that they really did not care anymore. You know, um, we had some very difficult patients, some very difficult clients. And it was evident that some of these older supervisors really did suffer from burnout and fatigue of their compassion, fatigue of their empathy. They just, let's do whatever you need to do and just be done with it. This has turned into just a very difficult job for them. So, a therapist's own practice can help with that. It can help with enhancing their empathy and compassion. And we'll talk about, awareness of countertransference, which is basically how the therapist reacts to a client being triggered. So the therapist's mindfulness practice is something that's really crucial. It's crucial for their well-being. And in the relationship with a client, the presence is what we consider to be most healing. This is when the therapist is fully engaged, they're emotionally available, and they're attuned in the moment. So they can know how to respond. They can maybe see where they need to go with the client. And a mindfulness practice really supports this by reducing people's automatic reactions so that a therapist can really see a client, even see them freshly, see them new, see that they're changing, see that they're having challenges instead of going on an autopilot or what they maybe think the case is going to look like, what they assume this clinical presentation is going to look like. They reduce their automatic reactions and they really increase their capacity to listen. Also tolerating silence. Sometimes, I think especially, when I've worked with some kids that maybe their parents want them to come to therapy, they don't know what to say. Maybe we can just sit together. Not for the whole hour, but at least some people have difficulty just tolerating 1 minute of silence. Me and you, we're just going to sit. Maybe you'll have something to say after 1 minute. I don't know. But this kind of practice helps with this tolerance. Maybe we know some people, it's hard. It's hard to sit in silence with another person. And also it can help with emotion regulation during difficult sessions. During difficult sessions, the therapist has to stay regulated. The therapist cannot be more afraid than the client. So, this is a question, something for you to think about, what do you think would happen when a client feels fully and deeply seen and heard? That they really feel like the therapist sees them, the therapist hears them. The therapist not just writing down the notes. Quickly, I need to put this in my report. Sometimes we go to the doctor and you feel like the doctor is behind a screen. They're typing very frantically. They need to write their report. So this is something to think about. What would it be like to be fully seen and fully heard? And I think for this to occur, that the therapist really has to have experience with mindfulness practice on his or her own. So I talked about this concept of countertransference. Mindfulness helps with this therapeutic process. And so in the field of psychology, we talk about a transference process. And this can occur, the transference is when a client is projecting their feelings about a difficult person onto the therapist. So I'm a middle-aged woman. Say I have a client who has trouble with their mother. I'm also a mother. I have a teenage son. Maybe my son has some trouble too, but we're talking about somebody else who's a client. So if that client who's talking about having difficulty in the relationship with his mother or her mother, they're now putting it on me, and they may see me like the mother figure that they have difficulty with. And the countertransference is what I do with that, what the therapist does with that. Do they now feel uncomfortable? How do they handle that kind of emotional response that the client puts on them? And it can make you very uncomfortable. I've had clients make me uncomfortable before, and you and I'm aware of it. You start not liking the client? Do you maybe not want to have more sessions with them? So mindfulness really helps the therapist's own self-awareness so that they can really observe their reaction. I can see that this client is making me a bit unsteady, that I feel this. I feel something, unsteady. I'm trying to help this person. I'm working with them, but I'm feeling a bit unsteady too. And that's okay. That's okay to be able to know your body, your sensations, your biases, what you think about this client or their kind of condition. What do you think about people that are suffering with the same kind of condition, like a depression? Do you have a bias about it? It could also make you less defensive and less anxious. So, without this kind of awareness that comes from mindfulness, therapists may unconsciously react rather than respond. And the mindfulness gives, I think, it gives a space. It gives a space between the stimulus, whatever the client is bringing, and your response. So an example, I talked about it a little bit, but another example could be a therapist notices that they are being irritated towards a resistant client. And so rather than acting in frustration, the therapist just observes this feeling with a curiosity, like, why am I being irritated? I know the client is suffering. I know that they are having trouble with therapy, or maybe having trouble changing, having trouble maybe quitting, changing an addiction. I know that it's not about me necessarily. So the mindfulness practice can really help with that. And then, I talked a little bit about therapist burnout and compassion fatigue. So there's a really large emotional demand of doing this kind of work, of doing counseling and therapy. And, therapists, they work with people that have had really difficult things happen to them. I've worked with survivors of trauma, different kinds of trauma, child abuse, sexual abuse, even something called religious abuse that people have talked about, natural disasters, severe depression and anxiety. And so it's very demanding, and it could be challenging and depressing for the therapists themselves. So mindfulness can really help therapists recognize burnout early. Oftentimes people talk about the therapist's own practice as like self-care. I'm not in love with this term self-care. I think mindfulness is not a self-care practice per se. It's really just it's a way of life, and it's more than just a self-care. Okay. So we talked about that first part. Now the second part is more of like the philosophy. Like the first part was what is the therapist doing? How is the therapist practicing him or herself or themselves? And the second part is like this philosophy. So how do you think about a case? So when you think about mindfulness as a theoretical orientation, oftentimes theoretical orientations are like psychodynamic, behavioral, cognitive behavioral, family systems, and so on. But if you think about mindfulness as a theoretical orientation, this goes beyond technique. This is a way of understanding human suffering. And the assumptions that can make mindfulness an actual theoretical orientation is looking at psychological suffering, looking at these assumptions. Psychological suffering involves attachment and avoidance. Thoughts are not necessarily facts. That this awareness, just being aware of what is going on, gives you the possibility for change. And acceptance reduces suffering. So there's a shift in the therapeutic goal. Most therapies or most therapeutic orientations, the goal is to eliminate distress, eliminate suffering, eliminate the difficulty that people have, eliminate the symptoms. A client has a high level of depression, a high level of anxiety. You want to eliminate that. Relate differently to their distress, to be able to have awareness of it, to have awareness of when they feel anxious, when they feel afraid. You're not trying to get rid of fear, anxiety, stress altogether. You're trying to have them change that relationship to it and have some awareness and compassion for themselves. The way that this can actually happen, like sometimes people ask, well, what is it that goes on in the mind that changes? What kind of mental changes can occur with the mindfulness practice for clients? So theoretically, we think it's something called decentering and cognitive diffusion. And here you are observing thoughts rather than becoming them. So mindfulness practice can teach clients that I'm having a thought that I'm afraid of heights rather than I'm always afraid of heights. I'm having a thought that everybody's watching me and they are thinking something about me rather than, oh my God, everybody's watching me and they think I'm, doing something wrong. So you're able to take a step back and you're able to observe. So you're observing thoughts as mental events. And this is like developing this witness stance or a metacognitive awareness. So decentering sometimes is called a witness stance or metacognitive awareness. And you're able to get away from basically the center of the nucleus of your thoughts and get a little bit farther and observe the thoughts as an event. And that reduces over-identifying with them. So it's not so scary. Okay, I'm a little bit nervous. I have some anxiety. It doesn't mean that the whole thing is, this is it. I'm in the nucleus of the anxiety. You get a little bit of distance. You get to almost travel a little bit. So it's like a mental space travel, a mental travel. And this kind of a cognitive diffusion, it creates distance from that unhelpful thinking. It can increase your flexibility as well. And so the impact of this is that clients become less controlled by their automatic thoughts. So these automatic thoughts are not controlling them as much anymore. They can be able to see it and sit with it. maybe even be friends with it. Okay. So there's also this idea about acceptance versus avoidance. So many psychological problems, psychological symptoms involve attempts to avoid them. So what do most people do when they have pain, anxiety, fear, shame, vulnerability? Yeah, they don't want to be there. They don't want to be there. They have some anxiety about something, they'll avoid it. And really, a mindfulness-oriented perspective is that avoidance intensifies the suffering. And so a mindfulness practice, I feel like it's really a way of being there with the difficulty. And, acceptance doesn't really mean that you like the pain or you like the suffering, but that you're making room for the experience and without becoming overwhelmed by it. So the goal here is to help clients tolerate more through their emotional experience. Okay. This one, I'll skip a little bit of this. I do a lot of couples and family therapy too. So mindfulness actually fits within attachment theory, but we'll move through this one. And the last part, I do want to save some time for either questions or discussion, but this last part, this is now mindfulness-based therapies and approaches. So we could learn about, people often take, years to really learn about these, but I just wanted to name just some of the most popular mindfulness-based therapies. So this is now the therapist teaching mindfulness that are in a well-known therapeutic program where there's, books and manuals and coaching and special teaching programs. So the first one is mindfulness-based stress reduction. And that one was developed by John Kabat-Zinn. And really he used that. I kind of call it a mindfulness boot camp. I've done this program myself and I've learned how to do it. It really is. It's like, when you go to like an exercise program, like, okay, that's it. We're going to train. We're going to train. We're going to run a marathon. So we have to, run 3 miles, then 5 miles, and then we're going to run 20 miles on the weekend. So this is like the mindfulness version of this boot camp. And it's meant for a hospital setting. They completely take out any Buddhism, any spirituality out of it, which for me is a bit challenging because I really do feel that mindfulness has to be taught, in its, I think, natural habitat, in its natural state. But this researcher has kind of cleaned, sanitary for a medical kind of environment. So that this is a very popular program for folks experiencing stress, pain, and severe medical conditions. Another approach is called mindfulness-based cognitive therapy. So this is for folks that have had chronic depression that recurs over and over again. And they really teach them how to do this kind of decentering so they're not stuck in this thoughts about the past. The third one, dialectical behavior therapy. I want to be fair, but I think that this is one of my favorite ones, and I used to actually facilitate this kind of a therapy. Mindfulness is sort of the umbrella or the core skill, and this is a type of therapy that integrates behavior change with acceptance and using mindfulness as a theoretical overarching perspective, and is used for clients that have trouble tolerating distress, trouble regulating their emotion and have also had such severe episodes that they've had either suicidal attempts or suicidal behaviors. So it's often used for individuals that have a diagnosis of what is called a borderline personality disorder, or they've had suicidal behaviors. And it's often used with very severely distressed populations. And I found it effective. That the mindfulness component here, and we'll talk about in a minute about some of the difficulties of using mindfulness practice in such severe kind of populations. And then finally, another very popular approach is ACT, or acceptance and commitment therapy. This really focuses and emphasizes on finding people's values. And it is a mindfulness and acceptance-based approach. It has more of the acceptance part of it, which is the value of mindfulness. And then more often so those are approaches that you could find training manuals on, many books on all of those approaches. But more often, what therapists do, and what I often do, is really integrate mindfulness into therapy. So for example, for I think almost all of the clients, I would probably say almost all of the clients I see, we begin with maybe between 3 to 5 minutes of sitting meditation. We do a mindfulness of the breath. We just begin the session with a breath awareness. And this kind of a basic practice, inviting the client, they come in. If you see them in person, they're coming, they're driving, it's stressful out there. Or I do also therapy, over like a Zoom video platform. But, people have to get to where they're going. And so this first few minutes, you ask them to notice the breath. Just notice their inhale and exhale. And then help them to redirect attention and practice non-judgmental awareness. So this helps them begin the session grounded, with their nervous system regulated, with present focus. And then we can move on, and work on what we've been doing. So this is a way that I really do every session, that I would begin with individual clients, and also working with couples. We begin with a few minutes of this mindfulness practice. So this is something that we can do really at any time in any kind of therapy. You don't have to do this full specific therapy, which it really takes quite a bit of training. And in any kind of therapeutic approach that you're doing, you could really integrate any of these things: body scan, mindful movement, just observing their thoughts, and so on. So lastly, I know we'd like to wrap up a little bit, but I do want to mention that in the last several years, there's been more and more information about trauma-informed mindfulness. And this is very important because there are many people that have experienced trauma. And depending on the severity of it, it's important that mindfulness practice, or the teacher, whether it's a teacher or a therapist that is doing a mindfulness practice with clients, that they are aware of what can happen and what can trigger. There's been this idea within the therapeutic community, from years ago, that like there's no there can be no harmful side effects to mindfulness. Meditation is good for everybody, and the more the better. Now, I have to say that's not always true. And, if we had more time, I could speak about a specific case. But individuals that actually have untreated post-traumatic stress disorder or have had some severe trauma, if you ask them, maybe for the first time, what to not avoid, to be present, close their eyes and sit with what's going on, it could really open a Pandora's box that is more than they can handle by themselves. And so it's important to really assess, what does a person need? Maybe they're not ready for it. Maybe they need to be mindful of something outside, like these beautiful flowers. And so when I mentioned that I had previously co-facilitated dialectical behavior therapy, almost everybody in the group had severe trauma in their history. And so asking them to practice mindfulness, practice like a mindfulness, say, of the breath, could be too much. We would oftentimes put a flower display or maybe a candle, and their awareness, it would be okay to be outside of themselves first on something that they found pleasant. And then you could get a little bit closer when they feel safe. So I think that's very important. And there's actually a book called Trauma-Informed Mindfulness that can really help. Okay, well, I think I'd probably like to wrap it up. I think one of the last things that I'd like to say is that there are some critiques about modern psychology and mindfulness. And, one of the main ones is the over commercialization about mindfulness and taking it out of the Buddhist origins and taking it out of, the ethics of it. So there's even a term called McMindfulness, like a McDonaldization of mindfulness. So that's definitely been a criticism. So, something that we can all reflect on, and especially in our field, is how can clinicians preserve the depth, the integrity of mindfulness traditions? So just, some closing thoughts. Mindfulness practice, it really invites both the therapist and the client to do similar things. Slow down, observe your experience compassionately, develop awareness, and it can potentially reduce suffering or like an attachment and cultivate connection and presence. Okay, thank you. If you'd like to connect with me, this is some of my contact information, both my email, my phone number, and this is, maybe you're familiar with this. This is a big hall that's at Naropa University. It's the Performing Arts Center. Thank you.
Professor, please. I have a question for you.
Yes.
But it's similar to something like a short discuss. Okay. As throughout the historical development of academic traditions around the world, most systems of philosophy, psychology, and social science have sought to provide methods by which human beings may attain happiness and improve the qualities of life. However, reality continues to show that humanities persistently face suffering, anxiety, conflicts, and spiritual crisis. From these perspectives, and Important economist questions may be raised. Why do many economist traditions primarily focus on increasing states of happiness rather than identifying and eliminating the root cause of suffering? For if the cause of sufferings are transformed or eradicated, suffering itself would naturally cease. In this context, I would respectfully ask for your scholarly perspective on the following question. Now, the question comes up. From your academic points of view, is meditation therapy, including mindfulness-based therapies, primarily a method for having individual attain happiness and psychological well-being, or is this fundamentally the path aimed at recognizing and ultimately eliminating the root cause of suffering? Please.
Wow, it's a very powerful question. Wow, we're going to solve the world's crisis. So this is interesting because originally I was not born in the US. Me and my whole family were from Ukraine, and I was born in Ukraine during the Soviet Union, during the Soviet occupation of Ukraine. So the people outside of the West or outside of the US have a different relationship to this idea of happiness. So, like people where I'm from, we don't expect to be happy. You know, Americans, everybody wants to be happy, happy, you know, smile, smile. Say Ukrainians or Russians or people from that area, the goal is not to be happy. The goal is to be free. So, but your question is very important. Does like a mindfulness practice, so say like a mindful meditation practice, is this for the individual or is this for somehow addressing the root causes of suffering, maybe at a global level? So that's a good question for everybody, that when you meditate, are you all here are together? Is it like it's like a sangha? You know, the Buddha identified three jewels, you know, Buddha, Dharma, and Sangha. And my who I consider my teacher, Thich Nhat Hanh, who passed away a few years ago now, was very famous for saying, the next Buddha will be the Sangha. So this is the energy, the collective energy. So when you meditate, do you do it for yourself or do you do it with the community, for the energy of the community? And can it actually change an energy beyond yourself? So I'm curious, what do you think? When you meditate, do you feel it's for you or for the collective good of the Sangha, for all the people? I don't understand either. It's That's a good question. Yeah, yeah. So I'm curious. Yeah, it, I'm curious what you feel.
According to my own experience, you know, at the beginning, we have to learn from meditation masters for sure. After that, we follow their methods, and sometimes when our mindfulness is calm low, we also need to sit together with the good friend too. Yeah, because we need the power, something like that.
Yeah, yeah, thank you.
The answer is made that okay, we need both.
Yeah, yeah. And I realize, a shortcoming of this idea of mindfulness in psychotherapy in this presentation is the assumption that there's going to be relief for the person. The therapist is going to meditate to be a better therapist, and then teaching the client to relieve something in them. But what about the roots of suffering? That Yes, that too. So I believe that a practice can go beyond that. Definitely, definitely. And that's why many people do actually criticize the field of psychology and counseling, and that it's individualistic, especially from a Western perspective, that this is about individual well-being. But really, I think that mindfulness and practice is about a collective well-being. So the roots of suffering, um, you know, I cannot be well. I can think that I'm well. I could be well, you're not well. But I think that this is not a correct thinking, that I can only be happy if we're all happy. So, meditating, practicing for a collective healing, I think, is something that's very wonderful. And yes, it is a criticism, and there is like a critical psychology about the reductionism and the individualism of the field in and of itself. So we're hoping to expand a bit. But yeah, thank you for your very deep question. Wow, I'm going to think maybe for the rest of my life about it. Thank you. Yeah. Oh, yeah, we have one more question. Oh,
Sadly, we have reached our time, and so once again, thanks, Professor Marina. Yeah, we take group photo, right? Okay.